friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonics Money Transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
We are not being biased. We just want added on.
kuy wut fu muy fanaan ak kuy wut ku ko wétali xanaa delloo buntu gi warul na boole Ria Fatus Guest House tijjil na leen buntu bi ñu leen fa am ak ñaari cabinet salle yu yaña
amal leen li nga xamantene mooy cabinet ak salle ñu ngi leen amal AC ak fan
salle bi nag lépp li ngeen soxla am na fa sofa yu nooy ñoo fa nekk TV bang fa cabinet boo dugga lal yu nooy leen fa amal nañ leen fa AC ak li nga xam ne moom mooy fan toilet yu set wicc man nañ leen fa
Thank you very much, and good morning to you all. As mentioned earlier, we're here to make a declaration of the coup in the Gambia. As you may be aware, a lot of global effort has been made towards kicking polio out of the face of this world. In 1988, the Global Polio Eradication Initiative was launched to guide global efforts to eradicate polio. Since then, the annual global polio incidence has decreased by more than 99%. The Gambia last detected a polio case in 1986 and was certified as polio-free in 2004. Over the years, the country has achieved and maintained high polio vaccination coverage in its commitment to global polio eradication goal. The country also conducted 27 high-quality supplementary immunization activities from 1997 to 2014 to boost immunity against polio. These activities were carried out in the presence of a robust surveillance system to detect polio cases when they occur. In May 2021, with support from the World Health Organization and other partners, the Gambia initiated environmental surveillance to supplement the traditional, that is the acute flaccid paralysis polio surveillance system. Presently, environmental samples are collected from 3 sites in the Gambia, Samples collected from the acute flaccid paralysis cases and the environment are sent to the regional polio laboratory in Dakar for analysis. So far, no AFP sample from the Gambia has tested positive for polio. However, 2 environmental samples collected from the sewage sites, one from Banjul and the other from Kotu, have tested positive for poliovirus type 2. This has created a polio outbreak situation in the country, since a single positive poliovirus case is considered an outbreak under the 2005 international health regulations, thereby requiring an urgent response to breaking the cycle of transmission. Many other countries are already affected by this type of virus in the sub-region. Sequencing results show that viruses detected in the Gambia are genetically linked to other viruses detected in the sub-region, such as in Guinea, Senegal, and Nigeria. Thus, there is evidence of importation of this virus. It is important to note that this outbreak is an evidence of poliovirus circulation within the population, but does not mean a detection of polio paralysis in the population. In line with the WHO recommendations, polio outbreak response standard operating procedures, and the International Health Regulations 2005, I officially declare this outbreak a national public health emergency. The Ministry of Health will continue working with all relevant UN agencies and other development partners in confronting the outbreak. While we plan for vaccination response shortly, we have enhanced our surveillance system to increase its sensitivity and quality in tracking poliovirus cases in circulation. We are preparing for at least 2 massive supplementary polio vaccination rounds, targeting 382,908 children.
Concise statement. We've all heard him. Actually, that's the declaration, which is an outbreak of polio type 2 in the country. As he rightly said, 1 case of polio confirmed in a country necessitated for the country to declare an outbreak and also public health outbreak of international concern. So this is something that we all have collective responsibility, and each and every one of us needs to know what to do. But as he rightly said, the Minister of Health is planning to embark on a vaccination campaign that is going to target close to 400,000 children, which we anticipate will definitely break the cycle of transmission. So this is something that we want our colleagues, journalists, to carry the news forward, let the public know about these there as a result of these events that just occur in the country. But again, we know, as he rightly said, the Gambia was certified polio-free in 2004. But again, kind of an imported virus from neighboring or sub-regions such as Senegal, Nigeria, and Guinea. So we are still going to intensify our surveillance system, especially environmental surveillance, and see how best we can quickly address this situation. So on that note, I thank you all for your kind attention. I think we will quickly open up the floor now for 5 for now, and we see how we are going to go about it. So we are going to have.
My name is Andrew John from African Democrats Radio.
Let me take some. From where? Africa. And where else? From where? Teranga. I have 5. 2 more. That's it. Okay, something.
Right, thank you.
So we have a team of experts from DPI who are also here with us, just in case you have some questions for them too, because they are going to be the ones in the community carrying out the actual work. Yeah. They can also ask questions. So yes, go ahead.
My question is, how prepared are we as a country, and how much vaccine do we have in scope to ensure, like you said, cut the spread of this virus? That's the first question. The other question, from the statement, like you said, it implies perhaps this has been imported. How prepared are we then in terms of our surveillance system? Because, as you're aware, Ivory Coast, Ebola has been detected there. If that is the case, how prepared are we for the future of for such outbreaks as well? And finally, I just want to know how the level of national vaccination program is ongoing, because all the time the minister said presidency has affected, the level of the vaccination. Thank you.
Thank you so much. I have to talk.
Yes, good morning. I am Lexis. I am vaccinated. In terms of transmission, how quickly can this virus be transmitted from one individual to another? If yes, how? Can it be transmitted from one individual to another?
Yes, I am Ben Mazuya. My question is, how do you intend to reconcile the mass vaccination? Looking at the current situation, people are in denial of the COVID, and then how do you intend to convince parents to bring forward their kids to have the vaccination done?
Thank you. All right, so the first question from Samuel, that is how prepared are we to deal with this outbreak, and how much of vaccine do we have in stock as far as the is concerned? Especially agricultural countries.
Yes, thank you very much for those questions. When it comes to preparation, the process is on, but this part of it, the identification, the surveillance system that detected it, detecting it is part of preparing for the response. Recognizing it as a public health emergency is part of the preparation, and which is what we are doing now. We had previously signed for the importation of those vaccines. It's actually regulated by the WHO, so we're already working with. They detected this in Senegal over 1 year ago. The strains they've been in circulation in the region. So something is known about them. Probably that has helped us to keep it early enough, because we were actively looking for it. There is a new oral polio vaccine called the novel oral polio vaccine that is being coordinated by 2 of our partners, the WHO and UNICEF. That will be what we'll be using. So the steps, various steps. So the actual rollout of the campaign, there are various steps, and those steps are being followed keenly. Surveillance is a continuous process since the declaration of the country as a polio-free zone. This surveillance never stopped. Behind the scenes, they've been quietly working, and interestingly, we've started the environmental surveillance mechanism, which is what picked this up. Ordinarily, the surveillance would have been children presenting at the hospitals with flaccid paralysis, symptoms and signs that's similar to poliomyelitis, polio virus infection, which is it causes paralysis in children. Now, and it causes other problems. So environmental surveillance is another step that is even more proactive than waiting to see it in the cases. With regard generally, the public health director is here. His team members are working day and night at the border post all over the country. The airports, they are there, and they are looking very keenly for any telltale signs of any infectious disease, whether it's polio or marburg or Ebola. They are very much aware, and everybody is on the alert. And it's also important to let you know that the team is now even expanding the rapid testing for COVID-19 at the land borders as well, not just the airports. So people at the land borders who come in will have rapid tests being done for them. So this is all geared towards strengthening our surveillance system to make this country infectious disease free, especially those that are imported across both the land, sea, and air borders. Thank you.
Thank you so much. I think yeah, so the vaccine, I think we made mention of the vaccination, so there are plans.
So we carried.
Yeah, that's the question from Taranga, right?
Yes, so we're dealing with that. It's a process, it's a continuous process. It never stops. We encourage people, and this is part of that. I'm happy you asked, and then we are happy that fortunately we've seen quite a lot of improvement with regards to vaccine uptake. You know, we were over 100. Uptake of the vaccine. That means the acceptance is increasing, but there's still a lot of work to do. We have realized that many of the cases of COVID-19 we see currently in the unvaccinated group. I think we have all attested to that. So that shows that there is some anecdotal evidence that vaccination helps. And this can be, the data is being looked at so that, you know, we are able to analyze it to categorically say A or B with regards to the benefit of the vaccines, which we know exist. But in our own context as a country, we want to analyze the data so that we can come up with some scientific information with regards to that. Yeah.
And I think that leads to the question from Sandra: how can we reconcile this mass vaccination of children with the ongoing public vaccination, knowing that there are still some hesitancy?
Yes.
And how do we
fortunately, vaccination, routine immunization, Gambians have accepted that all over the period. We all keenly send our children to be vaccinated. We were all vaccinated ourselves, and we had seen a drastic decline in vaccine-preventable diseases in this country, drastically over the period. Many decades ago, those were big issues in this country, but we no longer see them. So that we believe, with the help of the Almighty Allah, has been as a result of our robust vaccination program in this country. Yes, unfortunately, the COVID vaccines were preceded by bad publicity even before they were manufactured. And that continued, and then, you know, and people putting in all kinds of sentiments into it, and a lot of misinformation, because now, unfortunately, people can disseminate information so easily. Everybody has become his own journalist, rather than, you know, they just hear something and spread it through WhatsApp and everything without finding out the truth, like you people are doing, asking the relevant questions and then getting the answers. Some of them, they hear something and they circulate it. So that misinformation, we'll be happy if you can also add your voices and continue. We know you are doing it. Continue adding your voice to counter the misinformation. Because we keep on saying, and somebody said this, and it makes a lot of sense. Before we listen to some message on Facebook or WhatsApp saying negative things about the vaccination, why don't we get the information coming from the trusted sources that we know? The Ministry of Health, the WHO, our partners, I think it's better to listen to us than to listen to something on Facebook that we do not know who even put it there. So really, so I think we want to reiterate the fact that these vaccines help, and the majority of cases that we are seeing of COVID-19 today are amongst the unvaccinated people. So we appeal to everyone in this country to get vaccinated, and let us encourage our loved ones to equally get vaccinated. That will helpfully, inshallah, protect them. Yeah.
Just to add on to what you just said, if you see us or health workers going to embark on this particular campaign, I think it's important we raise awareness. So we send this message across to people that they have put. Vaccination has been going on and is still going on, even with COVID or before COVID. So we are still having children being vaccinated as a teen. That has nothing to do with COVID. So if this campaign also supposed to start, let the public understand that it's all part of the comprehensive healthcare topic. So health is not only limited to one disease or whatever. So we know we are battling with COVID routinely at the cases that are different from COVID-19 vaccine. So parents should accept their children to be vaccinated against polio if it happens to start. So I think that's important for us to understand. So the last question comes from Africa. That is the transmission rate. How quickly can this polio transmit from one individual to another?
Okay, so we'll allow our colleague here, who works with this vaccination, this immunization program, to give you further information on that, right? Okay, you can come and sit here. Yes, you can come and be with me here. No, sit down.
Okay, thank you very much. That is a very important question.
What's your name, sir?
My name is Aliou Sow. Yeah, I work with the expanded program on immunization.
Yes.
I work in the data and surveillance. So the polio virus is transmitted through the fecal-oral route, meaning it's passed through stools and through some unhygienic practices. If someone comes to ingest this and you are not protected, meaning you are not vaccinated, then you will have the disease. That is how it is transmitted. Thank you.
So how quickly?
This depends on many factors, including the concentration of the virus in the stool, and also whether you are vaccinated yourself or not. So, but it is not as infectious as diseases like measles, in which one case can, in an unvaccinated population, can give rise to up to about 18 cases or so. I think for polio is even maybe about 5 or so. But considering our vaccination coverage, and if we continue to vaccinate more people and children are immunized, then we will be able to break this transmission chain very, very, very fast. So that is already being done. We are vaccinating our children against polio, and we'll continue to strengthen that to make sure even if they come in contact with this virus, they will not be able to get the disease. Thank you.
Thank you. So I think it's also very important. He's mentioned the route of infection. Oral means mouth, fecal means feces. So that's a cycle. People getting contamination of what gets into their mouth. So that's why hygiene is very, very important. Proper disposal of feces is very important. We've all seen what happens to feces in the community when children pass stools, and then how they are discarded. And so that's why hand washing is equally important in this, proper disposal of feces, and the way the children are cleaned after passing stools. Too often than not, kids are cleaned but the caregiver doesn't use soap and water to wash the hands. We've seen that a lot. So that causes the cycle to continue. So I think it's very important that personal hygiene by the caregivers and the proper disposal of the feces is maintained. For many of these viruses, usually when viremia is high, when they have the actual symptoms, then they are able to shed more of the viruses in the feces. And the more viruses they shed, that means the more contaminated the feces become, and the more, the greater the chance for infection to occur through the fecal-oral route. So typically, someone jokingly said, for people to get fecal-oral infections, that means they would have consumed the feces one way or the other, whether it is in the water or from our hands or from the hands to the food or the food, because it gets to the feces and to the mouth. And how does it get to the mouth? That means we would have gotten something in the feces that goes around back to the mouth, right? Yes.
Vaccination campaign. I understand that the ministry is preparing for a massive vaccination, polio vaccination for children between 0 to 9 months. So I want to get the figures there. I had 180 plus from the minister slide.
82.
Yes, 380.
82,000, I guess. 908. Yeah.
Yes. Let me have the gentleman question over here. So, yes.
Yes, my name is Smallman from Japanese. Mr. So did mention paralysis as one of the signs of the type 2 virus. Aside that, is there any other sign of the paralysis?
Okay. So, back to duty, the chances of infection. What are the chances of one getting infected, and also when we show environmental civil cases, what does it mean to a human?
Good. Okay. Thank you very much. First, I think maybe I will start by explaining what environmental sampling is. So, like the Honorable Minister rightly mentioned, traditionally the global gold standard for polio surveillance is looking for acute flaccid paralysis cases, meaning people who present with some form of weakness or paralysis that is floppy-like among children under 15 years. So as we move towards eradicating polio, that is kicking polio out of the face of this world, then efforts became more intensified so that we'll get all possible chances of detecting the virus if it is in circulation. Then this environmental sampling came in. Environmental sampling, what it means is you go to places where feces or sewage is, and then you collect specimen or samples and test them for poliovirus. So in the Gambia here, one of our sites is in Banjul. We know Banjul has a sewage system, which all these toilets, etc., are connected to. So a sample is collected from them and tested for the poliovirus at the Nawek site. And then the other one at the Aqua Gambia also, we know many vehicles or many areas do use it, including the tourism development area. So for now, it is these samples that tested positive, but we are not able to say it is from this specific person. So this person is, or these people are with us in the society. There may also be people who were just traveling or passers-by. For example, Banjul, we know that many people use Banjul to cross to the ferry service, etc. But we are not able to say it is from this person. So the risk of infection is there if this person is in the society. So for polio, not every infection will result in paralysis. Paralysis is the most severe form of it. Usually about 1% or less will result in true paralysis. About 20% or so will just have a flu-like symptoms or febrile illness, and then the rest may be asymptomatic. But if this percent is, if so many people are infected, then even 1% becomes a very high number, right? For example, in 1988, there were over 350,000 polio cases. So that is a very big number. Yeah, I'm not sure if I answered your correct.
You know when exactly it was sampling?
Okay, the first Gambia initiated environmental sampling, like the Honorable Minister mentioned, in May this year. Yeah, so these samples first specimens collected did not test positive, but those collected on the 9th of June tested positive for poliovirus, and we received these results on the 23rd of July.
Thank you. So I think
yes.
So from GRS, or you want to add something?
No, it's okay.
It's okay. So GRS said, aside from paralysis, I think what are the other consequences of
yeah, they are just flu-like symptoms. You can have high fever, even headache, those kinds of things.
General malaise.
Yeah, general malaise, myalgia, etc.
Yeah, muscle aches and pains.
From the samples that were collected and you realized that the disease is detected, are you able to know maybe how many percent of the population might have? Because this is something that almost, let's say, the sewage, almost like many people, right? So I don't know if at all through that test you'll be able to, because I don't think like one person is having this and then having the sewage, I want to know exactly how many percent of people might have this virus for you to be able to detect that this is, yeah. Unfortunately.
Do you have any other questions?
Yes, London City from Cape Town. Yes, I came late and then I found the minister talking about the COVID-19 and the fake news or misinformation. I have a question about the verification of the COVID-19 vaccine that entered in the country that people are taking. I want to ask the minister whether the COVID-19 vaccines that are available in the country are well verified for people to take, because there are a lot of misinformation and disinformation surrounding the COVID-19 vaccine. So I need that clarification from the health minister.
Yes.
My name is my question, from the onset, you have been talking about children. Is this a virus that only affects children, and if yes, how deadly is the virus?
Any other?
I have a question. My name is Ridwan Ahmed Snanko from the Chronicle. My question is based on the minister's speech about the virus being detected in freezers. We've noticed that in most places like around Pelili, people do dump their waste materials outside. So how best do you think you can bring a change in making awareness to the people of those communities?
All right, so I hear maybe now again back to Ali.
Sorry, yeah.
Yes, so with the question from Patu Network. Yeah, so it's yeah,
Percentage.
So,
Yeah.
yeah.
Okay. Thank you. Thank you very much. That's also a very interesting question. Unfortunately, for now, you cannot tell from just environmental samples, because to be able to calculate the percentage or a proportion, you will need to get some kind of numerator and denominator, which is not feasible to do. So what can be done from the specimen is to sequence it and see which viruses it is related to or something like that. And from the sequencing results, it is found that these viruses, like the sample from Banjul and the other one from Aqua Gambia, they are connected to viruses from Guinea and Senegal. Yeah, so meaning they are somehow originally from those viruses. And if you taking all these viruses together, they are from actually they are related to the Jigawa outbreak in Nigeria. Yes.
Yeah, thank you very much. Certainly, before vaccines are introduced into any country, they go through a lot of processes. They go through robust checks and balances. Of course, I think one of the most important steps is to get vaccines from a verified source. That is why we always rely on recognized institutions for the supply of vaccines. That is a very good starting point because we've already seen in certain areas individuals talking about supplying vaccines to countries. Gambia is not taking those offers. Gambia is getting vaccines from recognized international sources. And even with those, a lot of paperwork is done with regards to verification. A lot of information is supplied to the country, back and forth. We send this information to the Medicines Control Agency of the Gambia that looks at all this available information supplied by the vaccine manufacturers and the suppliers before we get a go-ahead. In fact, even though we are government, but to get vaccines into this country, we wait for the go-ahead of the Medicines Control Agency in the Gambia. In fact, the last time with that, we were waiting for their approval. Vaccines were already somewhere, but we had to get their approval. So even government follows those rules. And then in the country, we have what we call NITAG, National Immunization Technical Advisory Group. That is a group of experts that looks at these vaccines. They look at what prevails elsewhere. They look at the type of vaccines that we are getting, and they look at all vaccine-related issues, whether it's COVID-19 or it is polio vaccine or hepatitis or BCG and so on and so forth. So we have robust systems in place to ensure that we get the best vaccines in the country. Unfortunately, the people who give misinformation, they don't give up. As you answer this one, they will come up with another one. You know, unfortunately, what keeps on puzzling me is what their motives are. Why people will be interested without evidence to misinform people. Because they don't have evidence, they don't have information, but they rather misinform people. And I keep on saying it's very sinful if people potentially could benefit from something, and then they get misinformed and they don't get that, they don't get the benefit, and they end up dying. It's very, very sinful. Now, somebody said, the people who know and they deliberately reluctant, their own is a little easier for him, even though we want to encourage they themselves to take. But he said he pities the people who are now confused because the institutions, government is saying, do this, it is good for you, and they want to believe it. On the other side, somebody is saying, don't do it, it's not good for you, and they are in the limbo. Those people, because of lack of information, or misinformation rather, they may not take the vaccines. And we have seen a recent case of that. A young man in his late 40s, you know, with a very young family. These people were saying, get vaccinated, and he didn't. Unfortunately, less than 2 weeks ago, he contracted a very severe form of COVID-19 and he passed away, leaving his 2 wives and small children, you know, at home. So that is very disheartening. His cousin, whom I know, took the vaccine, but they say they've been telling them to take the vaccine and he wouldn't because of the misinformation. So this is how serious misinformation really is. Yeah, thank you.
Thank you. So from daily news, children are they already affected, and if yes, how deadly is this?
Okay, polio is a disease that can actually affect anyone, but the most vulnerable are children below 15 years. So that is why global efforts are concentrated towards this. age cohort, except in a situation that, based on the epidemiology of the disease, we realize that the adult population is also affected, in which then we would extend our response activities to that age cohort. If not, it is usually restricted to this. So I think with regards to the deadliness of the disease, I think I mentioned earlier that about 1% of cases would likely end up in paralysis, and we know that also poliovirus, it can also affect the nervous system, the brain, and even affect how you breathe and things like that, resulting in death. So it is a very dangerous disease. In local languages, Mandinka, it is the disease people used to call dino. So if you ask our fathers and grandfathers, they will tell you about it, and in all of February Lafine.
Yeah. So typically, children are affected. They are more predisposed. Many of these infectious diseases tend to affect children more. Various reasons are there for that. If you even look at the route of transmission, you know, children are the ones usually crawling on the floor. Children are usually children can even eat droppings from other children. You know, they put whatever they pick on the ground into their mouths, you know, if the environment, so they are predisposed. But their immunity is also not as robust as those of the adults. But the poliovirus, too, the way it operates, because, you know, these microorganisms also have adaptations. It affects the central nervous system. When it does that, it affects the motor roots of the limbs. So that is why when it affects that, you know, it actually causes paralysis of that limb. And when it occurs in a developing child, that limb gets paralyzed. The muscles are weak. It affects the growth of the muscles. It affects the growth of the entire structure. That is why you have the individual limping on that side with malformed muscles, and even the limb tends to get shortened. The foot gets shortened and so on, and they limp. You have all realized that we are no longer seeing many cases of that in the whole world, especially in the Gambia. It used to be a little bit more common, but that is why we don't want that to come back. That is why we are making all these efforts to make sure that, you know, polio is dealt with from the onset. Thank you. Yeah.
So I think the last question comes from the concern about the environmental situation in some sites or in some communities. And how to change this kind of good behavior, and what are some of the awareness plans or creation plans that we have for this area?
Thank you so much. I think maybe this question, I'll answer part of it, and the Honorable Minister maybe can say more. So, thank you so much. With regards to talinding, myself, I never thought such actually exists there. So what we were aware of it, and because of that, talinding Darussalam is one of our environmental surveillance sites, but so far we have not detected a case from that. So what I think I'm happy to say that the Regional Health Directorate is very much aware of the situation there, and they are even doing a lot to address it in terms of sensitizing people and taking public health measures. And in fact, that is why we knew about it. Usually, when it comes to environmental sampling, people tend to focus more on sewage systems, more proper sewage systems or drainage systems. But it is from also our discussions with them that we came to know about that area, and then we included it in one of our environmental sites.
Yeah, thank you very much. Of course, with control of diseases, hygiene is very important. So any society where hygiene is poor, infectious diseases tend to exist to a large extent. Societies that have been able to deal with hygiene issues, whether it's sewage or whether it is cleanliness of solid waste in the communities, infectious disease rates are lower. So Gambia, that's what we are striving towards, but it's collective responsibility. Government has rules and regulations guiding the refuse dumping, management of sewage, but people should also abide by them. We heard of the issue of Chalindi. I've not visited there yet. I hope to do so soon, but the Public Health Directorate inspectors will be tasked to go and look at it. We learned that people are opening, waste disposal systems directly into a gutter, which is really, really not good. So public health people will go there and try to deal with that. But it's the responsibility of individuals to make sure that sewage is disposed of in an acceptable way. So it's our collective responsibility. The media, you also have a big role to play. Sensitize people. Tell them that what they are doing is detrimental to the health. And a lot of people will listen because they just need to be convinced. And our team will also continue to engage the media. The risk communication and behavior change unit is always doing that, but it's a continuous process. So we will enhance that, inshallah. Thank you.
Just to add on to that, yes, we are in cognizance of the importance of the environment with regard to open defecation. So currently, we are going in for GIS mapping for OD communities, that is open defecation communities, and also open defecation free communities. So we'll have this in a STEM, in a database, so that we'll know day in, day out the improvements taking place. If a community becomes OD free, we'll easily know, even by sitting here, we'll be able to, based on the coordinates, we'll be able to know which one is doing better and which one is doing worse. Yeah, so we'll be able to coordinate very well. This is based on improving environmental sanitation and hygiene. Yeah, so that is on.
Thank you so much. Yeah. I guess this brings us to the end of this session. So just for a take-home message, this is also important, especially for the latecomers. The Minister of Health has just declared an outbreak of polio type 2 in the country. Of course, you all have said 2 samples were tested yesterday for polio type 2. And this calls for a declaration of an outbreak in the country, which he just did. And there are plans from the ministry to embark on mass important as we said here. Aside from vaccination, we will continue with the environmental surveillance, and the public also need to cooperate with the health authorities. It is very, very important, especially when it comes to the vaccination program. So I think this is the message that we can get home, and make sure we sensitize the public on these issues, especially when it comes to environmental sanitation, when it comes to hygiene, and these are very, very important. So thank you all, and we wish you a safe.
If you want to receive monies from UK, Europe, USA, Canada, Switzerland and the rest of the world, Supersonic's money transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland and the rest of the world with our safe, secure, fast and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's money transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
fu muy fanaan ak kuy wut ku ko wétali xanaa delloo buntu gi warul na boole Yaa Fatus Guest House tijjil na leen buntu bi ñu leen fa am ak ñaari cabinet salle yu yañña
amal leen li nga xamantene mooy cabinet ak salle ñu ngi leen amal AC ak fan
salle bi nag lépp li ngeen soxla am na fa sofa yu nooy ñoo fa nekk TV bank fa cabinet boo dugga lal yu nooy leen fa amal nañ leen fa AC ak li nga xam ne moom mooy fan toilet yu set wicc amal nañ leen fa kitchen microwave fridge and room bu baax dama ne teranga day mut moo taxit Yaa Fatus Guest House amal leen extra kitchen lépp lu ngeen bëgg a togg mun ngeen ko toggee si gas cooker bii nii
kuy xalam di si jaayu nag barke bi yaay borom amal ne li nga xamantene mooy ndox ak courant 24/7 bu leen tiit bu leen ragal bu leen xof ndax amal ne lii di CCTV caméra
seet si leen ñu si Farafenni gannaaw garage base bi Kawur highway
very clean every day am na cleaning service ratio bi amul fenn
Yaa Fatus Guest House teranga aduna bët kon nag seet si leen ñu